question. A 75-year-old woman is brought by a patrolman to the emergency department because of altered mental status. She was found wandering next to the highway. The patient was unable to answer questions and collapsed in transit. Her vitals are temperature 33 degrees Celsius, pulse of 40 per minute, respiration of 12 per minute, blood pressure of 80/50 millimeter of mercury, oxygen saturation of 85% on room air. Physical examination shows decorticate posturing, incomprehensible speech, eyes open to pain, dry hair, coarse and waxy skin, and non-pitting edema around the face and all extremities. ECG shows sinus bradycardia. Laboratory studies show calcium of 9 milligram per deciliter, hematocrit of 34%, potassium of 4 milliequivalents per liter, sodium of 120 milliequivalents per liter, TSH of 110 microunits per milliliter, thyroxine of 1.2, T3 of 70. Which of the following is the most likely diagnosis in this patient? Yeah, this is myxedema coma. I think few of you chose option B or option E. I'm not too sure. But certain features, okay, even if you're not going to look at the entire presentation, anytime you come across any question, okay, where it says that the patient has dry hair or coarse and waxy skin, non-pitting edema around the face and all extremities, automatically, not automatically arrive at hypothyroidism, but definitely keep it at the back of your mind as one of the DD, okay, because most commonly this sort of, presentation, you're gonna have to correlate it to, case of hypothyroidism. So in this case, since the patient is presenting with hypothermia, okay, and she's very clearly having hemodynamic instability, she's having tachycardia, she's having hypotension, her respirations are okay, they're fine. And she's also, her oxygen saturation is pretty poor, okay. So in addition to that, she's having decorticate posturing, incomprehensible speech, clearly indicating that, okay, she's having some sort of brain dysfunction, okay. Anything pointing towards this, you can, and the fact that I mentioned features of hypothyroidism, you can already sort of arrive at a myxedema coma as a diagnosis. The laboratory findings are only going to support your answer, okay. As you can see in this case, the calcium is normal, potassium is normal, sodium is slightly reduced, but okay. TSH is elevated, T3, T4 are reduced. So once again, T3, T4 being reduced, TSH being elevated, it's hypothyroidism, just supports your answer, okay. So myxedema coma is the right answer. Pheochromocytoma crisis. Okay, so in this case, patient will usually present with palpitations, or they can present with perspiration, okay, otherwise diaphoresis, and they can also present with hypertension. So always look for hypertension anytime they're explaining pheochromocytoma. In this case, patient is having hypotension. One other feature of pheochromocytoma is its ability to sort of, it kind of like fluctuates almost. It rather comes in episodes, not fluctuate, it comes in episodes, okay. So in this case, you can just very, very easily rule it out. Septic shock, okay, yes, the fact that this patient has hypothermia, because if the patient were to go for shock, they can present with hypothermia, not necessary that just because of sepsis they have to present with hypothermia. It can be either of them, okay. And yes, hemodynamic instability is also seen in septic shock, but when you look at the other findings, okay, look at your sodium and potassium levels. Though the sodium levels are lowered, potassium levels are normal, okay. Since the normal range is between 3.5 to 5, it's 4, it's completely normal. So when you look at septic shock, automatically think of an, adrenal insufficiency. So secondary to an adrenal insufficiency, you should ideally have an hyperkalemia and hyponatremia. Like I mentioned, potassium is normal, so you're not gonna have adrenal insufficiency. Rule out septic shock, okay. It is, I understand, a little confusing this particular case just because, they seem very similar. But even if you don't have time or whatever, you're not gonna think so much in depth about this, just look at the thyroid profile, okay. The TFTs alone will help support your diagnosis, okay. Tertiary hyperparathyroidism, just rule it out. Calcium is perfectly normal, you don't even have to think twice about this. A thyroid storm, okay, usually going to be seen in patients with hyperthyroidism. Once again, thyroid function tests help just support your diagnosis of hypothyroidism. You don't even have to think twice about thyroid storm, okay.
Thanks for watching. Please give a thumbs up and subscribe for more.